Welcome to Cancer and Common Nutrition Myths, a part of our quarterly cancer nutrition series, Eating Healthy with Cancer. I'm Amy Blunk. I'm the Survivorship and Supportive Services Initiatives Manager. And I'm going to talk to you a little bit about this class series. So nutrition is an integral part of our cancer survivorship program here at Intermountain Health. And it's a very important aspect of care for anyone who's been impacted by cancer. The Eating Healthy with Cancer series is designed to provide you with the knowledge and tools that you need to optimize your well-being, enhance your quality of life, and be confident with the food choices that will help you no matter where you may be in your cancer journey. We also offer these quarterly, as I mentioned, and you can use the same Intermountain Classes and Events website you used to register for this course to see all of our upcoming classes as well. And we look forward to seeing you at a future session. So now, without further ado, I would love to introduce our wonderful presenter, Carrie Evans. Carrie is a registered dietitian who supports our oncology patients at the Intermountain Medical Center here in Murray. Carrie, please take it away.
Thank you, Amy. Yes, I'm really excited to be here and to talk about this topic, cancer and common nutrition myths. I've worked a lot with patients, both inpatient and outpatient, and I just really find it rewarding to work with this group um, who are like trying to either work with their treatments, reducing side effects, and also just trying to continue on with survivorship. And so a lot of times these questions come up about, does this regimen work? Or I've heard this diet is good and all that type of thing. And so I'm just pretty much thinking that this is going to be hopefully helpful to everyone to know what common nutrition myths are out there and of the things that how to determine if it's going to be helpful or not, or even dangerous. So we'll go through some of these things and then we'll allow questions at the end. Okay, so we'll first talk about the common nutrition myths and their impact on health, and then we'll review the myths and how to find accurate nutrition information from the misinformation, because there is a lot of it out there, and then also to review the evidence-based nutrition and lifestyle recommendations. So I was thinking it'd be beneficial first to kind of just review our what the um, why we eat and what the nutrients do, and then breaking it down to like our carbohydrates, protein, and fat, and what the importance is of each one of those. So our carbohydrates, they are a major source of energy. And the types of foods that have those would be your breads, your rice, your pasta, kind of more of the starchy foods, but also like your fruit. And the protein is going to be basically for building and repair. And you can find that in your lean meats and fish, but also in your plant proteins like legumes, tofu, and peas. And then the fats are to help absorb nutrients. And there's a variety of them. Mainly the plant fats are going to be most beneficial. So you have your nuts, your olives, butter, seeds, and avocado. And so a healthy diet would be a combination of all these things. And at times people will ask, well, can you, eat them? Do you need to eat them all together or can you eat them separately? And so the goal is they can be just included in your diet throughout the day. It doesn't need to be at that particular time. There was a time when, like with protein foods, with the a vegetarian diet, they used to say that you'd have to eat, the amino acids at the same time in order for it to be a complete protein, but it's not necessarily to do it all together. You can do it like throughout the day and it would still have the benefit. And then we always emphasize plant foods to help lower the risk of chronic disease such as heart disease and diabetes. And reduce the red and processed meats that contain saturated fats. So healthy fats, there's a nice variety of your olive and vegetable oils, avocados, your nuts with the peanut butter, the flaxseed, and then you have fatty fish. And the benefit of these is that they provide an anti-inflammatory benefit. And they help lower the cholesterol and they keep your brain sharp. And the goal is to have 2 servings of fatty fish a week. And then the thing to watch out is that they are high in calories. And so if you are trying to, limit the amount of calories you have or, have a weight loss goal, then you need to watch the portions. And so we just want to include them, but kind of keep it all in perspective as far as how much. And then carbohydrates are kind of one of those things that people just seem to have a lot of misunderstanding, do I lower my carbohydrates? Do I, have any at all? Or do I, eat specific ones? But there's the 2 different kinds. There's the simple carbs and then there's the complex carbs. So the simple carbs are going to provide the immediate energy and they're more easy to digest, whereas the complex carbs are more of a longer lasting energy and they take longer to digest because usually they have the fiber and whole grains and that, which makes it a little bit more, stays with you a little longer than say the simple sugars. And the complex carbohydrates are naturally occurring in whole fruits, vegetables, beans, and whole grains. So it's really easy to get those in if you can include those in your diet. Again, along with the fats, with carbohydrates, you want to choose them wisely. There's especially the simple carbohydrates, which can are more sweet, and they may be more like simple sugars, like sucrose and table sugar in that. And so you want to be careful in limiting those, whereas trying to increase more of the complex carbohydrates. And like anything, if you have too many calories, the body will store it, and so you'll have more stored as fat. Complex carbohydrates provide antioxidants, vitamins, minerals, and fiber. And just because weight gain is something that we want to prevent with cancer, is you just need to be careful with the total amount of calories that you get. So the first myth that I'd like to cover is, does sugar feed cancer? And there's kind of this the anti-cancer, anti-carbohydrate debate. But sugar or your carbohydrates, all carbohydrates are broken down into some form of sugar. And like we talked about in the previous slide, is that your energy is going to come from the carbohydrates. So you don't want to restrict those. It's necessary for your body's function. And so if you look at it through the, normal cells and cancer cells, both of them require glucose for energy. And so the thinking is that if you starve you don't eat sugar, will it starve the cancer cells? But no, you cannot starve cancer cells by eliminating sugar. And the reason is that when glucose is not available, the cells will pull glucose from other sources in the body, like fat and muscle stores. So you wouldn't want that to happen if you're especially like losing weight and your muscle stores. Does eating sugar cause cancer? And the question is, no scientific evidence linking sugar intake. There is no scientific evidence linking sugar intake and cancer growth. However, diets high in simple and added sugars can lead to weight gain, increased risk for diabetes and insulin resistance, which are linked to an increased cancer risk. You want to focus on eating natural sugars found in whole food, plant-based sources such as fruits and vegetables. And you can see like there's the added sugars in that diagram up there, and that's a sugar that is added to foods and in the processing, but then there's also the natural sugar, which you get from fruits and vegetables. And it's more unprocessed. By reducing added and simple sugars, you can like eat a little better diet, because a lot of times those tend to crowd out more healthy foods, and they also are empty calories. And then it has been from the dietary guidelines for Americans in the year 2020 to 2025, and the American Cancer Society and the World Health Organization, they all recommend limiting added sugars to about 10% of calories. And so if you look at that, that would be about, if you were following like a 2,000 calorie diet, that would mean that for that 10% that you would have about 200 calories less, no more than 200 calories a day from the added sugars. It's kind of interesting. It was about around the 1970s that there was the push to reduce saturated fat and cholesterol from the diet to help with heart disease. And so during that time, this opened up the door for the production of like fat, low fat, fat free products, food products. But what happens, they ended up having a lot of, they contained a lot of sugar. And so things like, say, licorice, was low fat, but it did have a lot of extra sugar. So over the years, we've seen that this trend towards our increase in sugar intake over the years. And so it's kind of been interesting that now not only do we want to watch the amount of fat in our diet, but also the sugar. They were just saying the average intake for a person per year is about 45 kilograms of sugar, which equals to about 236 cups of sugar, or 0.6 cups of sugar per day, which I calculated out to be about 28 teaspoons of sugar a day. And so, you think, well, what does that relate to? Or, how can I figure that out? So just to show you, like a can of Coke would have 35 grams of sugar, which is equivalent to about 7 teaspoons. And that's just the 12 ounce. So say if you have like a 20-ounce Coke, then you're going to get about 65 grams of sugar, or it would equal to about 13 teaspoons or about 240 calories. So if you had like a 20-ounce, there would be that 200 calories coming from a simple sugar, and that would be all you got for the day. But again, it's the simple sugar, it's empty calories, and there's much better things that you can get for that allotment for the simple sugars. So I thought that was kind of interesting just to see the trend over the years. Another myth that might be out there is artificial sugars cause cancer. So if you're not eating sugar, what about the artificial sugars? And so just the definition of artificial sugar is that it's a chemically altered sugar or amino acids that do not provide energy or calories to the body. So some examples are like aspartame, which is NutraSweet and Equal. You have saccharin, which is the sweet and low, and then the sucralose, which would be Splenda. There's others out there. Stevia is grown from a plant. It's more of a natural source and can be processed to be made into a white powder and liquid sweetener. So all of these, through research, the FDA approved them to be safe to use in foods and beverages. So there's currently no evidence that artificial sweeteners increases the risk of cancer. So the question is, how do they affect our health? So they found that it can reduce the dental caries. You're not eating sugar, so you're not going to be causing more of those, like the bacteria hurting your teeth. And so that helps. And then also it can help manage diabetes. There's no effect of on the blood sugar with the artificial sweeteners. And so that can help stabilize blood sugars for better management. And then weight control. They found it to be beneficial, definitely because you're lowering the amount of calories that you have intake. And then they found short term, it's easy to kind of, they could follow. But when you get into the long term, the reason there was unknown research for the long term is that it's harder for most people in general when they lose, when they're on the weight management short term, it's easier to maintain your weight loss. And then as time goes on, it's harder to follow and keep up with the same regimen. And so they don't know whether, if they're not keeping that weight loss during the long term, if it's related to having the artificial sweeteners or if it's just related to just the normal attrition, like not having the same kind of weight management. And then headaches, you probably have heard that aspartame may trigger migraine headaches in some people. So that may be a negative. And then some studies show that large amounts of saccharin may negatively affect the balance of bacteria in the gut. So it's just some things that are out there. So eating soy increases breast cancer risk. Is that a true statement? So researchers initially believed that soy could increase estrogen in the body. And so therefore they told, like, especially, women who were more at risk for breast cancer not to have the soy because it may increase the estrogen in their body. And so they kind of started out with that, but they found that this was not proven. So there is a positive benefit to soy foods, especially with those that do have, say, estrogen based breast cancer. They find that it does contain a phytoestrogen, but that is a plant estrogen and not a human estrogen. And then soy foods, if kept in moderation, are safe and beneficial. So a moderate amount would be like 1 to 2 servings per day. The types of foods that would have the soy foods in the whole food form would be like your tofu, your tempeh, soy milk, and soy nuts, and edamame. And so the studies suggest eating soy foods in moderation can lower breast cancer risk and recurrence. There is like always a question that comes up. They say, like, can I still have protein drinks, that have the soy-based protein? And usually those would be safe. The soy protein found in those would be okay, but maybe soy pills or powders are not going to be recommended for breast cancer. Sometimes the soy powder isolates can have very concentrated amounts of soy, and so it's not recommended for the breast cancer patients. And there's inconclusive evidence on the effect on breast cancer. So it's best just, I think, to be in the safe realm, just to make sure that it's coming from a whole food type of soy. So another myth, and this is kind of interesting, like an alkaline diet fights cancer. So the claim is that acidic foods can raise the pH, increasing cancer, while alkaline foods lower the pH and help fight cancer. So the idea is that an acidic environment, they think that cancer cells can proliferate, can grow more in that kind of environment. And so looking at the type of foods that have more acidity would be like your meats, your poultry, your fish, and dairy. And then the alkaline foods would be your fruit and vegetables. And so it's quite varied. But they say that you can't alter your body's pH by the foods that you eat. That your lungs and kidneys are there to help maintain your pH. And so they adjust and do whatever depending on how things are going on. And so you don't want to have to mess things up by trying to eat all one type of food. And there's other, like, I know groups out there trying to sell, things like the alkaline water. It's more expensive, and they keep saying, you need the alkaline environment, but there's no evidence to support the idea that alkaline water can treat or prevent cancer. And there's some disadvantages with trying to follow this kind of a plan, is that by eliminating acidic or protein-rich foods, it will make it difficult to meet your nutrition needs. as you can see, like if you eliminated meats and poultry, fish and dairy, that's your main protein sources. And if you just stuck with the alkaline foods, fruits and vegetables, you are going to be deficient in protein. And that is not going to be good as far as, with muscle and just not being able to have a balanced diet to help with your immunity and giving you strength. Okay, here's another one. Juice cleanses and detox regimens fight cancer. And there's a lot of this out there. I just heard the other day someone in the hospital I was talking to, he was saying he was doing like a cleanse, a juice cleanse, because he had just recovered from, he had like I think it was a virus or something. He thought, oh, I'll just do a cleanse just to try to help remove the harmful toxins and wastes that my body might be having right now. And so the thing is that your body naturally removes the harmful toxins and waste that put your, anything that puts your body at risk. And the disadvantage that this prolonged restrictive fasts are low on essential nutrients and may cause headaches, low blood sugar, electrolyte imbalances, nausea, fatigue, diarrhea. So all these kind of side effects, which don't make you feel very good. They have like the colonic enemas. They carry the risk of perforating the intestinal wall and causing blood infections. And I looked it up, and like a colon cleanse, one regimen was where they flushed either water or other substances like herbs or coffee up to about 16 gallons at one time, or 60 liters through the colon. And you can see why that would be pretty harsh, and can be dangerous. And so it's good to know that it can be dangerous and linked to several deaths. Natural methods are not a substitute for medical treatment. And so you wouldn't ever want to try to rely on, thinking that if it's natural, it's going to be safe or effective, but it's definitely not going to either fight or cure cancer, and it could put you at more risk. So there's little scientific evidence that detox regimens and cleanses reduce the risk of developing cancer. Another myth is dietary supplements. Do they fight cancer? So the claim is that they're perceived as anti-cancer and anti-toxicity agents. You have to be careful because they have compounds, supplemental herbs, or other compounds that are not like inactive. They could be active and could interfere with other things that are going on. So when you eat, it's very important to realize that the whole foods, you're going to get a better absorption of the nutrients, your antioxidants, the phyto chemicals. All those things are going to be in the foods in the whole food form. Now they try to duplicate that by putting them into a supplement, which doesn't always carry over the same way. I've seen on commercials where they, one commercial in particular had, they said, oh, if you can't eat all your fruits and vegetables, you're struggling with that, here, just take this little pill and it'll have cover all your dietary needs for fruits and vegetables for the day. And I'm just going, how does that little pill take the place of the fiber and all the nutrients you get from eating the whole food itself? So it's just kind of been interesting with that. Supplements are poorly regulated and don't always provide what they claim. And supplements should not replace nutrient-rich foods. Dietary supplements may interact with cancer treatment or make the treatment less effective. And that's what I was talking about. They have these compounds that may interfere with the treatment. And there may be times when you may need like a supplement. Say if you have iron deficient anemia then you want to have, an iron supplementation. Or if you have osteoporosis and vitamin D and, you know, calcium, all those things would be, essential to kind of help bring up your levels. And so there will be those times, and it's always important to review any supplement that you are taking with your medical provider to make sure that it's safe and that it's not interacting with any of your cancer treatment. So our protein powders and supplements needed to reach my protein needs. It seems like a lot of out there is saying, "Oh, you got to get your protein. You got to make sure you get your protein." Especially athletes, are saying, "How can I increase my protein intake? I need it, to increase my muscle." And I think there's a little misunderstanding of how much protein that that you really need. And so here, I just kind of put out there. So you kind of do this calculation where you figure out what your weight is in kilograms. And so you take your pounds, you divide it by 2.2, and that is your weight in kilograms. And then say you were, a 200-pound person. So if you took that and you multiply that by 0.8 or 1, you would take the kilogram weight. 0.8 to 1 would be about 72 to 90 grams protein per day that you need. And so the equivalent, like 4 ounces of meat, would give you 28 grams of protein. A cup of milk gives you 8 grams. A quarter cup of nuts would be 6 grams. And so throughout the day, you can see if you ate, on a regular basis, your breakfast, lunch, and dinner, you could adequately meet your protein needs without the assistance of, these protein drinks and things like that. And so it is a doable thing. It's just, you just have to kind of choose your foods wisely. Now, with an endurance or strength athletes, they have a little increased amount of protein needs, so it'd be 1.3 to 1.6. But that also can be met by a balanced diet. And I calculated it out for like the 200-pound person. So that would be like 117 grams up to like 145 grams. And so just kind of looking at that, you think, oh, usually like here they show the palm of the hand, that's a 3-ounce portion of meat. And that would give you, say, about 21 grams of protein. So if you had like, say, 3 of those during the day, or say most people would even eat more than the 3 ounces. So 4 ounces would be 28 grams. And so that's about around 90 right there. And then milk would have, 8 grams. So you could end up by the end of the day meeting those needs, even if you were an athlete, because they definitely eat more than the normal person. You just want to be careful that you're not eating too much protein because it can be converted to carbs or fat and possibly leading to the weight gain. And too much protein can also lead to liver and kidney overload and dehydration. So you want to be careful, especially those who have like kidney disease. They definitely need to keep their protein intake at a more moderate to lower level, just to not tax the kidneys. So it's not appropriate for everyone to increase the protein to the extremes. And it is important because a lot of times people, will need those protein drinks. They are beneficial for people who aren't able to eat, or they need, supplemental intake, especially those who are struggling to eat during their cancer treatment. And there's a number of them. I know here in the hospital, we just really promote a lot of the protein drinks. They call them oral nutritional supplements because they have such a good source of protein, and they have other nutrients, vitamins, minerals, have carbohydrates. And I think there are times for that, but it shouldn't be just like, oh, I'm going to have my protein drink for lunch, because I need the protein. You can get it through other foods. Plus, you can get other nutrients when you eat those other foods, like your fruits and vegetables, the fiber, all that kind of thing that goes together with it. Okay, now this, there's pros and cons with a ketogenic diet, especially with cancer. So here I've got just a diagram circle of, what is the recommended intake? And these are the percentages. So like for the fat, 20 to 35% of your calories will come from fat. Protein, there's 10 to 35%. And then your carbs are about 45 to 60%, 65%. So that's the recommended intake just for most people. Now, if you go with the keto plan, it definitely decreases that carbohydrate to only about 5% of the calories. Your protein is going to be about 20%, and then your fats are going to be 75%. So you can see it's real heavy in your fat content, not much in your carbohydrate, you have moderate protein, and so it's definitely going to affect, I think, energy levels and that. But with the cancer, the rationale for this is that without enough glucose, by not eating it, your body switches to burning fat for fuel called ketosis, which breaks fat into ketones. So cancer cells lack the ability to use ketones for energy. And then that is where cancer cells are starved of glucose needed to survive, while normal cells adapt to using ketone bodies. There's definitely going to be some disadvantages to that. And so you have to kind of weigh out, there's still a lot of research to be done out there, but what's going to be the best thing for my individual case. So I just have here different things that are involved with someone following a ketogenic diet and some of the side effects. So it's against advice of a diet rich in plant foods, like what we've been suggesting, vegetables, whole grains, fruit. It's going to be short on that. And so, having more protein or say more fat, maybe someone with heart disease and that kind of thing, it would not be the best diet for them. And so another disadvantage with high fat is that it may increase nausea and digestive issues. And especially people going through cancer treatment, that's not going to be an easy thing. It'll add to maybe what they already are experiencing with the treatment. And then low fiber intake may increase constipation, which, you know, that alone is bad, but also with the low fiber intake, it could increase your risk for colon cancer and some of these other cancers where fiber has been encouraged. And then restrictive and difficult to sustain. It could cause disordered eating, just trying to, work on different things. It's just kind of throws off the kind of just your balance. And then let me just go back one more. And then it's not safe for certain medical conditions. And, definitely like the kidney, those with kidney disease, with the high fat, high protein, and then diabetics, low in carbohydrates, it's going to throw them off as far as their blood sugar control. And then the side effect of wasting disease called cachexia, which is a scary thing as far as in the cancer world. It's one of those things that it's very hard to come back from once you get this cachexia, and it seems to be, you want to catch things early so that you don't have to like try to backtrack. And so if you're on top of it with keeping your calories and your muscle, you're going to have a better outcome. But with the side effect of wasting with this, it's because what happens with a ketogenic diet normally is to help people lose weight. And so that's not the goal that most people have who are fighting cancer. So currently there's no major cancer health organization that recommends the ketogenic diet for cancer patients or for cancer prevention. Intermittent fasting, to fast or not to fast. I know this is kind of a popular thing right now for people who are trying to lose weight. And so I know there's also another component where they're trying to see if it helps with with cancer patients tolerating their treatments. The thing about this intermittent fasting is it focuses on when you eat, not what you eat. And that's where I think the problem comes in. The different fasting schedules are, it's a 16-8, which would be 16 hours of fasting. And then you have 8 hours where you can just eat what you want. And then there's the 5 to 2 where you fast 24 hours, 1 to 2 days a week. So you may be eating 5 days a week and the other 2 days you'll be fasting. Or there's another plan where you alternate days where one day you eat, the next day you fast. And so that kind of works depending on what regimen you choose. The claim is that fasting reduces cancer risk or side effects during treatment. It's not appropriate for people who are malnourished, have diabetes, or those with chronic diseases. And side effects, you have headaches, fatigue, low blood pressure, dehydration, and the so-called hanger. When you're not eating, it's definitely going to get into your mood and affect your mood. And nutrient deficiencies are definitely a possibility with this because it's a restrictive regimen. And so you would either tend to overeat those days that you're able to eat, or you undereat because you maybe didn't have time to eat those days. And so it just messes you up. And so there's definitely some nutrient deficiencies that can happen. And I think overall, with the idea of this plan trying to help with weight loss for those that are working on that, is that it's more important on what you are eating, not necessarily the timing. And so where this works more on the timing, I think it's better to focus on what your overall calorie intake is. And I think that would be much more effective at controlling your weight. So more research is required before reaching any conclusions on the impact of fasting on cancer risk and treatment. And so this next slide, I just decided to kind of go out on a limb and talk about cannabidiol CBD. Is it safe? And from my research, I just found, okay, it's a chemical found in the cannabis plant, oil extracted and ingested as a liquid, capsule, gummy, or vape. And it has a lower psychoactive effect because it has lower levels of the THC, which is the more goes with the psychological aspects of it. It may be useful for pain relief, anorexia, nausea, and vomiting, but it has not been studied very much. And it's because it's been illegal under the federal law, and then it's now been in use for medicinal use by each state. And so each state has their different regulations. And as of now, there's not really any scientific evidence that it's safe and effective. More of the anecdotal, more subjective evidence is out there. And there's 2 synthetic cannabis medications that the FDA has approved to treat nausea and vomiting, and it's Sesamet and Marinol. And so I think along with everything else, when there's not a lot of evidence as far as the safety, you always want to counsel with your physician, as it may cause side effects, possible drug or disease interactions, and there's just safety concerns. So you want to be sure that you talk with them. And it's also important to remember to not forego any more effective treatments for certain conditions. So there's great medications out there. And so, if they will work better, that would be the way to go. So identifying nutrition myths, separating fact from fiction. How can you be sure the nutrition information is reliable? And I've got some red flags, what to look out for. If it promises a quick fix, say it's going to, if you take this product, then you're going to, everything will be resolved, just in one day. It's not going to be actually anything that's reliable. Keywords like guaranteed results, cure all. I think definitely when you hear something's going to be cured, you kind of go, oh, even with the recommendations from evidence-based research, they always are really careful in how they word things. But here, when they say cure all, guaranteed, there's usually no guarantee. If the claims sound too good to be true, if it focuses on specific foods or cuts out specific food groups, it's just important to realize, if they're cutting out, how you shouldn't have the fruit, you shouldn't have different things that, let's get this. There's some plans out there where they'll say, like in weight loss plans I've seen where they say, oh, you don't need to exercise, or you don't need to do, some other things that we know are important for the overall health. If they say you don't need to do all those things, that's kind of a clue. It promotes supplements to relieve problems, and then they have the intent to sell the product, gain attention. It's all just kind of a big clue right there. So you want to consider the source. There's reliable resources out there, and you have the American Institute for Cancer Research, AICR, your National Cancer Institute, there's MD Anderson Cancer Center, Memorial Sloan Kettering Cancer Center, and websites, anything that's ending in .gov or .edu are going to be reliable. And there's many more. These are just some examples. You want to ask these questions about the research with the study. Did the study withstand peer review, and can results be replicated? A lot of times, they'll say this one study, it showed this, but it never, showed that again. So you want to be careful with that. Was research population, was it large enough, or the length of the study long enough? So, if it was just a study that was just, a couple days versus, say, I think the better studies are the ones that are long-term, a couple of years, that they've followed a certain study group for, most of their lifetime. I mean, definitely you can see that's going to be more reliable. Does it avoid absolutes such as the proofs or causes? And then scientific evidence, is this all going to be in line with the scientific evidence that's out there? And then what are the author's credentials or qualifications? And I keep thinking, yeah, if you, want to have something fixed, you're going to go to the expert. If you want to, go somewhere, fly an airplane, you're going to have, make sure that whoever's flying that is the expert. With nutrition, you want to seek the expert. Registered dietitian nutritionists are the experts. Here you have the kind of the plan of what dietitians go through to become registered. They have to follow, complete a bachelor's degree, an accredited program, an internship, a master's degree. You have to pass your exam. You have continuing education requirements. And then many are specialized in certifications that go beyond that. And then you abide by a code of ethics. And then the protected title. And then as far as nutritionists, so-called, you want to be careful because, they don't usually have formal education requirements, no examination or regulated credentialing, no continuing education. They don't have a protected title. Literally anyone can call themselves a nutritionist. And then there are many certification programs out there. You may see, oh, you can become a nutritionist, do this course this month, and then you'll, get your certification. But of course, they're not regulated, and they're inconsistent. So getting to evidence-based nutrition and lifestyle recommendations, want to be sure, we emphasize plant-based or Mediterranean style diet, where At least 2/3 of the meals are from fruits and vegetables, whole grains and beans. And what I like about this picture is that it's very colorful looking. You have, the phytochemicals from your fruits and vegetables, the colors, um, and you can see it's got a good balance of things. And so you want to balance with your protein, your starch, or your carbohydrate, the complex carbohydrate, and then your fruits and vegetables. You also want to limit red meat to 3 servings per week. You also want to limit how it's prepared. If it's grilled, barbecued, or smoked, there's um, carcinogenic properties when you say have the grilled meat where there's burnt pieces and that kind of thing. So you want to limit any chance of that in your diet. And then 2 to 3 servings of low-fat dairy products. Definitely, you can have dairy products. There's yogurt. There's low-fat cheeses, things like that, which would be very beneficial. And then limit refined carbohydrates. So here's another picture. You can see it looks totally different than the other one, but it looks very processed, not very colorful, and here it says like fast foods, you go out and eat and one meal could provide about 1,500, 2,000 or more calories. So that's like, for some people, that's a full day's allotment. And if you went to, let's say if you got like a typical meal, it could have like 5 tablespoons of fat, a third cup of sugar. I did once a calculation from a McDonald's meal, and that's the amount that it came to. And I would pour out, how this is a third cup of sugar in that. This is, you're also getting like 5 tablespoons of fat. So you just want to be careful. Occasionally it's fine, but overall, if you're trying to, eat right, just go with the plant-based and moderate amount of protein if you're having like the animal protein. Processed foods, high in fat and sugar, starches, salt, definitely those are things that you want to limit in your diet. Red and processed meat, 12 to 18 ounces, and that's about, say 3 ounces 4 times a week, or depending on the size. You could even have less than that. And then the sugar sweetened drinks, we talked about how they can increase the simple sugar and non-nutritive, and they're also high calories. And so the goal is to drink more water. Be a healthy weight. 42% of US adults have obesity, is quite high. And this diagram just shows all of the cancers associated with overweight and obesity. You see it's most of them. And then maintaining the weight helps to protect against cancer and helps with prevention of recurrence. So does it matter what diet I follow if it's easy and promotes weight loss? I just kind of put this together because I think a lot of times we're just saying, oh, as long as it's doing what it, I want it to, can't I just follow it? But certain things to look out for. Does it leave out any food groups? If it does, definitely it's not going to be a well-balanced or a healthy diet. Does it promote faster than 1 to 2 pounds weight loss per week? That's kind of our standard, if it creates more weight loss than that, then it's definitely not sound. Does it use strange food combinations or promote miracle foods? Is it something you can follow long term? And that's, I think, a big key factor. You can do anything for short term, and that's why people usually can lose weight on something that they follow for short term. But as soon as, does it really teach them anything? Have they learned any good habits along the way as they, to kind of keep that throughout? You just want to avoid that yo-yo back and forth with your weight changes. Does it include exercise at least 150 minutes per week? And that's about 30 minutes, 5 days a week. And so that's always going to be important to maintain your muscle. And then here it just kind of the pendulum. So calorie intake kind of versus your calories used, your exercise. And that's how you kind of determine how many calories you need is what your expenditure is. And then if you're eating more calories than what you really need, you're going to gain weight. If you're exercising more, then you can definitely eat more to balance that out. Being physically active, move more and sit less. 150 minutes per week is going to be goal. Prevents weight gain and manages anxiety and depression. So you get all those added benefits, and reduces the risk of breast, colon, prostate, endometrial, and pancreatic cancers. Our recommendations are to follow the plant-based diet, such as the Mediterranean or one similar to it. Prepare more meals at home. I think the more you tend to eat better when you prepare more meals at home. It's going to be more cost effective. You eat more variety, and there's a lot of social aspects as far as, you know, who you're eating with, families, and that is going to set up a good guideline for long-term eating and stability. Make eating plan each week. I think that helps, you know, the spontaneous buying food and you're hungry, and so you know, have to eat out because you haven't planned your meals for throughout the week. Include plenty of vegetables, fruit, whole grains, and beans. You limit your processed foods and red meats. Limit the consumption of sugary drinks and drink mostly water. Maintain a healthy weight and increase physical activity to at least 150 minutes per week. And so in conclusion, there is an abundance of information out there on nutrition and cancer. And it's understandable that we want to try to fight cancer, alleviate, you know, treatment side effects. I think it's just, you have to figure out what's going to be beneficial and what's not, and then be aware of how to find reputable information, and then follow the dietary and lifestyle guidelines advised by the evidence-based research. So, if there are any questions, and then want to thank you for this opportunity to present. And here's a list of resources that would also be beneficial. There's a link here for some short videos that are speaking on the hot topics of nutrition and cancer. And then there's a good website, the Academy of Nutrition and Dietetics. You can find a lot of helpful information there, as well as the American Institute of Cancer Research, kind of the up-to-date research of many of the topics we've talked about. And then the American Cancer Society. And then we are going to have further classes, and so you want to be sure to check in for signing up for them. Next class will be Cancer Prevention and Survivorship, April 11th at 2 p.m. And we have two of our dietitians presenting that. And then there's a QR code to fill out for a survey. And if you have any questions, you can email to this BNT dietitian .org site. So that's all that I have. Thank you.
That's great. Thank you so much, Carrie. Can you go back one slide?
Oop.
Yeah,
One more.
perfect. Yeah, no, that's great. The one that lists our next one coming up at April 11th at 2. It is a quarterly series, this Eating Healthy with Cancer series, and we'd love to see you at a future session. And you can check out that website, that Classes and Events website, same one that you use to access this recording, to access those future sessions and register. And yes, please reach out with any questions. Thank you so much.